Hello, welcome back. I'm having a great day today. I'm kind of feeling like a little bit of sugar. So let me grab this. I'm not advertising. This is a Reese's Peanut Butter Cup. It's one of my favorite things in the entire world. Well, why am I doing this? Well, I'll tell you. Sugar is a problem. Sugar causes diabetes. Does it? Well, not exactly, but an excess of sugar in a person who has diabetes is very dangerous. It can actually cause damage throughout the body. But diabetes is an interesting disease. It doesn't just show up willy-nilly all at once. Diabetes often shows its face early in life, particularly in women. When women get pregnant, one of the things that we do is check them for diabetes. We call it gestational diabetes. Gestation relating to the pregnancy. It's very common to have diabetes in pregnancy. There's a couple of things that are really interesting about this. The placenta, you may or may not know what a placenta is, but a placenta is what feeds the baby during the pregnancy. It processes all the blood, brings the nutrients, the energy source, everything that the baby gets filtered essentially through this placenta. One of the things the placenta does is it makes a hormone called human placental lactogen. And that particular hormone has an interference with insulin. Insulin is what you need to use your body. It's a hormone that your pancreas makes, and it's needed to process sugar. If you don't have insulin, then you have what we call type 1 diabetes or juvenile onset diabetes, because it often comes about when you're really young, sadly. A very serious illness, terrible experience at 8 or 9 years old. Very common, juvenile diabetes, because they have no functional insulin. So insulin's really important to process sugar. It's more important in pregnancy than ever because the human papillomavirus actually blocks its effects. It blocks the ability of insulin to do its job. It makes you need more insulin to do the same work to clear whatever sugar you took. Reese's, more sugar. Other things like vegetables, not as much sugar. So at the end of the day, when you're diabetic in pregnancy, gestational diabetes, it's something that we find out because we test for it. We test for you having that problem. We test everybody who's pregnant because it's such a common problem in pregnancy. One of the interesting things about it, and I'll tell you about the testing in a second, but the most interesting thing I thought about it was that if you do have or had a history of gestational diabetes, it increases your risk of having real diabetes, generally what we call type 2 diabetes, normally or used to be called non-insulin dependent diabetes, because your body still makes insulin. It just doesn't work as well. It doesn't respond. The rest of your cells aren't picking up and processing the insulin as well as it could. That's kind of like it was in gestational diabetes because of that hormone, human placental lactogen. It prevented your body from optimally using the insulin that you already made. So sometimes we actually have to give you insulin or give you medications to control your sugars in pregnancy. Well, let's talk about that specifically in pregnancy. Why does it matter? Well, if you have diabetes, what can happen in the pregnancy is the baby can be affected. The baby is exposed to excessive amounts of sugar if your sugar is high, because it goes right through the placenta and it gets exposed to the baby. And just like sugar makes us fat, see, I got some here. Well, I don't know if you can see it, but I do, trust me. Just like I have it, the baby will get it too. They will get extra calories, more than they need, and it will lay itself down as fat. So they'll grow bigger, harder to deliver, not much fun at the end of the day, but also potentially dangerous for a number of reasons. The babies can actually get stuck when they're having a birth at a greater percentage risk when they're diabetic baby, when they've had a diabetic exposure, than when they haven't. That's called shoulder dystocia, if you've ever heard of that. Not a fun time, not a fun experience. It can happen at any point, but much more likely with diabetics. But also babies just increasing in size, they don't even come out that way, and you need a C-section, which has its own sets of risks, and surely we'll talk about that here in the future too. But at the end of the day, if you have a pregnancy, you're going to be checked for diabetes. How do they do that? Well, it's kind of ironic actually. They give you a test like everything else to check. There are different ways to do this. There are screening tests and there are diagnostic tests. That's true in everything, and that's true with gestational diabetes. At St. Helena Women's Health Center, we typically will check you early in your pregnancy when you first come in to see us for diabetes if you have risk factors. And risk factors are kind of subtle. If you have family history of first-degree relatives of diabetes, if you yourself have had gestational diabetes in a previous pregnancy, if your family history, ancestry is Latino or Hispanic, it's much more common to have diabetes in that population than, say, Asians, for example. But any risk factor, we will typically test you early in the pregnancy. And as I said, there are screening tests and diagnostic tests. Classically, a screening test would have been applied. They would give you a sugary drink, kind of ironic there, which has 50 grams of sugar. Well, that's not that much sugar. It's about 200 calories, 50 times 4 calories per gram, 200 calories in that little drink. Don't worry, we're not getting you fat just from that. But you'll drink that, and then we'll check your sugar about an hour later. That's a screening test. If you have an abnormal result, then we would go and do a diagnostic test. That diagnostic test takes either 2 or 3 hours depending on the particular place. We actually have tended now to go to diagnostic testing only, where we just give you the 2-hour test up front. You would fast, meaning no food for 12 hours. You'd go in the morning, you would get your blood tested to see where your sugar was in a fasting state, where you don't have any extra sugar, to see how well your body can control it in the absence of any threatening, provocative issues like Reese's peanut butter cups. We would do that to diagnose it, and then 1 hour after you drink the fluid, and this test has 100 grams of sugar, so a little bit more, but at the end of the day, you drink that in 1 hour, and then 2 hours, we draw your blood again. It doesn't sound like fun, probably isn't that much fun, but you only have to do it once. And we know, we have now a diagnosis that you either have or you don't have gestational diabetes. And knowing that, we can treat you. And usually, the good news is the treatment is really just eating healthy and exercising. As simple as just walking after you eat. In fact, whether you're pregnant or not, walking after you eat is a really helpful way to lower your average sugars and probably lower your risk, not only of diabetes, but heart disease. It all works together. We hope we've helped you a little bit today. There's obviously a lot more to talk about with gestational diabetes and diabetes in general. We'll do it in the future. We'll do it when we see you at St. Helena Women's Health Center. Thanks for coming. Have a blessed day.